بسم الله الرحمن الرحيم. Common infectious diseases of children by Professor د.سمير الحسن. In this lecture, I'm going to discuss infections with rash or exanthematous fevers. Exanthem means rash on the skin. Another term is known as enanthem, which means rash on the mucous membrane. According to the type of rash, exanthematous fever are classified into infections with maculopapular rash and infections with papulovesicular rash. Maculopapular rash includes scarlet fever, measles, German measles, Rhiziola infantum, and erythema infectiosum. And an example for infection with papulovesicular rash, we will study a chickenpox or varicella. Infections with rash will be discussed under the following headings. Number 1, epidemiologic aspects, including causative agent, mode of transmission, incubation period, and the infectivity period or period of contagiousness. The causative agent may be viral, bacterial, or fungal or otherwise, but most of the infectious diseases with rash is due to viral infections. The mode of transmission is very important, whether it is airborne, foodborne, or otherwise. This is important for prevention of spread of infection. And the incubation period is very important. It's important for diagnosis of the disease, tracing the origin of the disease, and isolation of a suspected person. An incubation period may be short, few days or less than 1 week, or it may be from 1 to 2 weeks, or it may be longer, from 2 to 3 weeks, as we will see. The infectivity period is very important for isolation of a patient in order to prevent the spread of infection to healthy children or healthy individuals. We will discuss also the clinical aspects, and we will classify the clinical manifestations of infectious disease with rash to prodromal stage or early disease, and eruptive stage or stage of the skin rash, and the convalescence stage or the stage of fading of the rash and the effervescence of the fever. We may shortly discuss the complications and how to investigate a case. Most of the exanthematous fevers can be diagnosed on clinical basis, and we will mention the prevention and the treatment. And most of the viral infection are symptomatic treatment and treatment of complications. This figure illustrates the clinical manifestations of different infections with rash. Clinical manifestations include temperature chart, the rash, and the correlation between the appearance of the rash and the start of rise of temperature, and the associated signs and symptoms. Of the associated sign and symptom, there is a pathognomonic sign. Why pathognomonic? Because the presence of this sign is of a diagnostic value for each disease. So from the combination of all these temperature, skin rash, associated sign and symptom, we can easily diagnose most of the infections with rash on clinical basis. Now we will start by scarlet fever. Scarlet fever is an exanthematous fever. Causative agent is group A beta hemolytic streptococci, strains producing erythrogenic toxins. An incubation period is less than 1 week. The infectivity period is only 1 to 2 days after start of penicillin therapy. The mode of transmission, as we know, is airborne through droplet infection. What about the clinical manifestations? As we mentioned before, we are going to discuss under prodromal stage, eruptive stage, and convalescence stage. The prodromal stage is characterized by high temperature, may reach 40 degrees centigrade, sore throat, abdominal pain may be present, and the high temperature may cause febrile convulsion. The eruptive stage is characterized by the appearance of rash. The rash is erythematous rash, appears in the second day of fever, causes redness of the skin, on the face. The rash causes redness of the face except an area around the mouth called circumoral pallor. The skin is rough, punctate, like a goose skin or sandpaper-like. This is about the exanthem. What about the enanthem? There is enanthem. If you examine the mouth of the child, you will find a white coat over the tongue with a red projecting papillae. We call it white strawberry. The white coat falls and leaves a red tongue with enlarged papillae. We call it red strawberry. Other signs is pustuous sign. Pustuous sign is transverse lines, dark transverse lines present in the antecubital fossa, which do not fade on pressure. What about the convalescence stage? The rash fades with peeling of the skin, especially the fingers and toes. What about the complications of scarlet fever? Scarlet fever may cause early complications and remote complications. What about the early complications? Includes spread of pyogenic infection, peritonsillar abscess, otitis media, pneumonia, hematogenous spread, septic arthritis, meningitis. All these are pyogenic infection, spread of the pyogenic infection. Remote or late complications include post-streptococcal glomerulonephritis or scarlet fever. What about the laboratory diagnosis? We can do leukocytic count, which will show polymorphinuclear leukocytosis, antitryptolysin O titer, rapid antigen detection test, and throat swab for identification of the organism. The drug of choice is penicillin, given for 10 days to eradicate the infection. This figure shows the clinical manifestation of scarlet fever, including temperature chart, rash, and the associated signs and symptoms. As you see, sore throat, high temperature, and the rash appears in the second day of fever. This picture is of a child with scarlet fever. As shown, there is redness of the whole face except the area around the mouth, which we call it circumoral pallor, and it is a pathognomonic sign for scarlet fever. This picture shows the punctured skin, rough skin. We call it gauze skin or sandpaper skin. The same is rough skin, punctured skin over the trunk and the extremity. This picture shows the Bastia sign, two transverse dark lines in. As you said, that the rash fades with peeling of the skin. As shown in this picture, there is peeling of the skin. This picture shows also peeling of the skin. As shown, it is peeling of the skin of the fingers. This is white strawberry The tongue is coated with white coat and the projecting red papillae. It is called white strawberry. This is red strawberry. The tongue is red and the papillae are enlarged. This is called red strawberry. Measles is a highly contagious disease caused by measles virus. An incubation period is 1 to 2 weeks. The isolation period or period of infectivity is 4 days before to 5 days after the start of the rash. What about the clinical manifestation? We'll start with the prodromal stage. Measles is characterized by severe prodroma, including high temperature up to 40 degrees centigrade or more, conjunctival congestion and photophobia, severe rhinorrhea, and severe dry cough. The eruptive stage is characterized by the appearance of measles rash, which is red spots appear at the hairline and spreads over the face, then the trunk and extremities. On the trunk, the rash combine to each other and becomes confluent. What about enanthem of measles? If we examine the mouth of the child, opposite the molar teeth, we will find what we call complex spots. Complex spots is red spots, few millimeter in diameters, and in the center there is grayish white spot. Complex spots is pathognomonic sign of measles. What about the convalescence stage? The rash fades, leaving brown pigmentation of skin which may remain for weeks or even months and causes discoloration of skin, fine discoloration of the skin. We call it briny discoloration. What about the complications of measles? Measles has severe complications. Gastrointestinal, including severe diarrhea, mouth ulcers, which may lead to gangrene of the mouth, bleeding from the mouth. Respiratory complications includes pneumonia and flaring up of a dormant tuberculous focus. Neurological complications include meningitis, meningoencephalitis, subacute sclerosing panencephalitis, and it may lead to malnutrition and cachexia. Eye complication includes corneal ulcer and corneal opacities and even blindness. What about the prevention of measles? Measles is a vaccine preventable disease. Vaccine is a live attenuated vaccine. Treatment is a symptomatic treatment and the treatment of complications. This figure shows the clinical manifestations of measles, temperature chart, the rash. The rash appears in the fourth day of fever, and the appearance of Coblic spots. Coblic spots appear 2 days before the rash and 2 days after the rash. And the associated signs and symptoms, including severe distressing dry cough, severe coryza, and severe conjunctivitis, as we mentioned before. This picture shows the pathognomonic sign of measles Coblic spots. As shown, Coblic spots are red spots with a central grayish-white spot. This rash is present on the buccal mucosa opposite the molar teeth. This picture of a child with measles, rash over the face and chest, conjunctival congestion, photophobia. All these are among the clinical manifestations of measles. This picture also shows the clinical manifestations of measles. This picture shows the confluent rash over the trunk. Also, confluent rash over the skin of a child with measles. German measles. German measles or 3 days measles is caused by rubella virus. The incubation period is longer than that of measles. It is from 2 to 3 weeks. The infectivity period is 7 days before to 5 days after the rash. What about the clinical manifestation? Prodromal stage is a mild prodromal stage when compared with the prodromal stage of measles. Mild, including mild coryza, mild conjunctival congestion, malaise, and lymph node enlargement. The lymph node enlargement in German measles is very important since it is the pathognomonic signs of German measles. Lymph node enlargement appears before the rash and remains after the disappearance of the rash. Lymphadenopathy in German measles is a specific lymph node enlargement, including the preauricular lymph node, postauricular, and suboccipital lymph node enlargement. What about the eruptive stage? The rash starts on the face as red spots. It is discrete. Discrete means separate rash. Then spreads over the trunk and extremities. The time it appears on the trunk, it disappears from the face. Is rapid spread and rapid fading. It takes about 3 days and fades without leaving any sequelae. Complications of German measles. The serious complication of German measles is the transmission of infection to a pregnant woman, which especially in the first trimester, which may cause congenital complications in the fetus, including congenital heart diseases, including neurological complications, gastrointestinal complications, and so many complications may occur to the growing fetus. Complications of German measles includes encephalitis, post-infectious arthritis, post-infectious thrombocytopenia occur, but as we said, the most serious complication is transmission of infection to pregnant female. What about the diagnosis? German measles can be diagnosed on clinical basis, and laboratory investigations include serological tests, IgG and IgM, isolation of the virus, prevention. German measles is a vaccine-preventable disease. A live attenuated vaccine can be given in combination with measles and mumps vaccine or as a separate vaccine. Treatment is symptomatic treatment like other viral infections. This figure shows the clinical manifestation of German measles. As shown in the figure, the temperature chart, there is mild rise of temperature, and the rash appears with the elevation of temperature and remains for 3 days and fades without any sequelae. As shown, the associated signs and symptoms including coryza, conjunctivitis, and malaise, and lymph nodes enlargement, which is the pathognomonic sign of German measles, and as shown in the figure, the lymphadenopathy starts before the appearance of the rash and remains after the disappearance of the rash. So we can diagnose German measles only by specific lymph node enlargement, as we mentioned before. This picture is of a child with German measles. As shown in the picture, there is a red spots scattered all over the face and the upper chest. The rash is discrete. It may misdiagnosed as German measles, but there is no circumoral pallor. A discrete rash of rubella on the trunk. This radiograph shows one of the complications of congenital rubella syndrome is congenital heart disease. Another complication of congenital rubella is congenital glaucoma or ophthalmos. This is a picture of cataract in a child with congenital rubella syndrome. Rosella infantum. As the name indicates, it is an infectious disease of infants. It is rarely diagnosed after the third year of age. Causative agent is human herpes virus type 6 and 7. The incubation period is from 1 to 2 weeks. What about the clinical manifestations of Rosella infantum? Rosella infantum has a characteristic clinical picture which we can diagnose the disease on the basis of clinical manifestation. What about the prodromal stage? Is characterized by high fever, 40 degrees centigrade or more, which may cause febrile convulsion. In spite of the high fever, the infant is in a good general condition, and this is very important. There is no localizing signs for such elevated temperature. The temperature remains high for about 4 days, not responding to antibiotics or empiric antibiotics. And in the fourth day of fever, the fever drops by crisis, sudden drop of temperature. With a sudden drop of temperature, A rash appears over the trunk in the form of red spots and spreads to the face and extremities, and it takes few days, 2 to 3 days, and disappears without any sequelae. The appearance of rash in relation to the drop of temperature is like a rainbow after a storm. Treatment is symptomatic treatment, and there is no vaccine for Rhiziola infantum. The pathognomonic sign is the appearance of the rash with the drop of temperature, unlike all the other exanthematous fevers. This figure shows the clinical manifestations of Rhiziola infantum. The high rise of temperature, which remains for 4 days, a sudden drop of temperature with the appearance of the rash. The rash takes few days and disappears without any sequelae. The associated sign and symptoms or the prodroma is high fever and irritability of the infant, but still, as I said, the infant is in a good general condition, and this is very important sign. This picture shows the rash of Rhiziola infantum. As shown, this is a picture of an infant, and the rash is scattered over the trunk. As we said, it starts on the trunk and spreads to the face and extremities. This is a characteristic rash of Rhiziola infantum. The last exanthematous fever, characterized by maculopapular rash, is erythema infectiosum or slapped cheek syndrome or fifth disease. The causative agent is virus parvovirus type 19. Incubation period is 1 to 2 weeks. Infectivity or transmission of infection carry the risk of affection of children with hemolytic anemia, which may induce a plastic crisis to these children. So it is very important to isolate a patient with erythema infectiosum from a child with chronic hemolytic anemia. What about the clinical manifestations? Prodromal stage is mild or no prodromal stage, mild elevation of temperature, common cold-like symptoms, or even no symptoms. The eruptive stage is characterized by the appearance of an erythematous rash over the cheeks, like fingerprints. We call it slapped cheeks. Then the rash appears over the trunk and extremities. Its characteristic rash, we call it lace-like or reticular rash or mosaic-like rash. This rash is transient or evanescent. It disappears and reappears again after exposure to sun, to hot bath, to exercise, or to stress. The rash fades without any sequelae. Complications of erythema infectiosum includes aplastic crisis in children with hemolytic anemia, and sometimes it may cause fatal hydrops or stillbirth. Diagnosis can be diagnosed on clinical basis. Treatment is symptomatic treatment like other viral infections. This picture shows the slapped cheeks in a girl with erythema infectiosum. This is the slapped cheek syndrome rash over the extremity. This picture is of characteristic rash of erythema infectiosum. What we call it is a reticular form or mosaic-like or lace-like. It's characteristic and is pathognomonic to erythema infectiosum. Now we are going to discuss an example of exanthematous fever with papillovesicular rash. It's varicella or chickenpox. The causative agent is varicella zoster virus. Incubation period is 2 to 3 weeks. Contagiousness from 1 to 2 days before rash and until all lesions are crusted. It takes about 7 days. What about the clinical picture? Number 1, the prodromal stage is mild or inapparent in the form of mild elevation of temperature and common cold-like symptoms. What about the eruptive stage? Lesions or skin eruption of chickenpox appear first on the trunk and spreads to the face and the extremities, what we call centrifugal in distribution. The eruption appears in crops. It means groups at different times, starting with a macule, changes to papule, then vesicles containing clear fluid, then turbid fluid, then the vesicles ruptures and make a crust. The appearance of rash in crops gives the characteristic pleomorphism of varicella infection. We are going to find lesions in the vabular stage and lesions in the crust stage and lesions in the vesicular stage and so on. So it is pleomorphic over different shapes. The lesions end by a crust which falls, leaving a depigmented skin, which takes a few weeks to return to the normal color. But never the varicella causes ulcers of the skin unless there is a secondary infection, bacterial infection, and causing bioderma. So the two pathognomonic signs of varicella are centrifugal distribution of the rash and pleomorphism of the rash. What about the complications of varicella? It may cause cerebrolitis, leading to cerebellar ataxia, or it may take a severe form in children with atopy, or secondary infection, bacterial infection causing bioderma, or in children with bleeding tendency, it may cause hemorrhagic varicella. Treatment includes symptomatic treatment for itching, antihistaminics, local soothing agents like calamine lotion, and antiviral treatment like acyclovir. If given early in the first 24 hours, it may shorten the duration of infection and the severity of the infection. Antibiotics, if there is fever, and aspirin should not be used for reduction of the temperature or for as an antibiotic because it may induce Reye syndrome. So avoid aspirin in varicella or even in any viral infection. Prevention of varicella is there is a live attenuated vaccine for prevention of varicella infection. This picture shows an infant with a chicken pox. The rash is present over the trunk and also the face and extremities. The rash usually appears in the first day of fever. In the first day of fever. This also shows the polymorphism of the rash of chicken pox. Thank you.